Every single night, millions of American seniors go to bed following the same routine they have followed for decades, completely unaware that certain habits they consider harmless or even comforting are quietly placing dangerous stress on their heart, their brain, and their cardiovascular system while they sleep. 5 specific nighttime habits are the focus of this video. Each one has a clear body of medical evidence behind it. Each one is more common among seniors than the general population, and each one is something you can change starting tonight. Stay with this until the end, because the 5th habit is the one that surprises people most, and it may be the most dangerous of all. Habit number 1. Sleeping with the television on. This is one of the most widespread nighttime habits among older Americans. For many seniors, the television provides comfort, companionship, and a sense of security, particularly for those who live alone. Falling asleep to the familiar sounds of a television program feels natural, even soothing, and for decades, most people assumed it was entirely harmless. The medical evidence tells a different story. Light is one of the most powerful regulators of the human body's circadian rhythm, the internal biological clock that governs sleep cycles, hormone release, body temperature, and dozens of other physiological processes. The primary hormone involved in sleep regulation is melatonin, produced by the pineal gland in the brain. Melatonin production is directly suppressed by light exposure, particularly blue light, which is heavily present in the light emitted by television screens, smartphones, and tablets. When you fall asleep with the television on, your brain is receiving a continuous stream of light signals throughout the night, even through closed eyelids. This suppresses melatonin production, disrupts the natural progression through sleep stages, and keeps your nervous system in a state of partial alertness rather than allowing the deep, restorative sleep your body needs. For seniors, this matters enormously. Deep sleep specifically, the stages known as slow-wave sleep and REM sleep, is when the most critical cardiovascular restoration occurs. During deep sleep, blood pressure drops significantly in a process called nocturnal dipping. This drop in nighttime blood pressure gives the heart and blood vessels a period of reduced workload that is essential for long-term cardiovascular health. Research published in the Journal of the American Heart Association found that sleeping with any artificial light, including television light, was associated with a significantly higher prevalence of obesity, diabetes, and hypertension among study participants. All 3 of these conditions are major risk factors for heart attack and stroke. A separate study from Northwestern University found that exposure to even moderate light during sleep raised participants' nighttime heart rate, increased insulin resistance the following morning, and activated the sympathetic nervous system, the body's fight or flight system, during sleep hours when it should be at rest. For a senior with existing cardiovascular disease or hypertension, activation of the sympathetic nervous system during sleep represents a genuine cardiac stressor. Beyond the cardiovascular effects, television audio creates its own disruption. Television programming, particularly news broadcasts, crime dramas, and action content, contains sudden loud sounds, emotionally activating content, and irregular audio patterns that can cause repeated microarousals during sleep. These brief partial awakenings, often not remembered in the morning, fragment sleep architecture and prevent the sustained deep sleep stages that are most restorative. Here is what you need to be aware of. The effects of poor sleep quality compound over time. A single night of television disrupted sleep has modest effects, but years or decades of this habit create a cumulative cardiovascular burden that increases risk significantly. The practical solution is straightforward. Use a sleep timer on your television to shut it off automatically after 30 to 60 minutes after you have likely fallen asleep, but before the disruption of a full night's light and sound exposure accumulates. If you rely on background sound for comfort, consider a white noise machine or a dedicated sleep sound device which provides consistent, non-stimulating audio without light exposure. If you find complete darkness uncomfortable, a very dim, warm-toned nightlight positioned away from your sleeping area is far less disruptive than a television screen. Habit number 2, taking certain medications at the wrong time of night. This habit is more nuanced than the others on this list, and it requires careful attention because the issue is not taking medication at night in general. The issue is the timing and combination of specific medications relative to sleep and the cardiovascular effects that certain medication timing patterns can produce in older adults. Seniors take more medications on average than any other age group. According to data from the Centers for Disease Control and Prevention, nearly 90% of adults over 65 take at least one prescription medication, and more than 40% take 5 or more, managing multiple medications, keeping track of timing, dosage, interactions, and instructions is genuinely complex, and it is entirely understandable that many seniors develop simplified routines, such as taking all their pills at bedtime for convenience. However, certain classes of medications have cardiovascular and physiological effects that can be dangerous when taken at the wrong time, particularly for older adults whose bodies process drugs more slowly and whose cardiovascular systems are more sensitive. The first category of concern is blood pressure medications. Blood pressure naturally drops during sleep, the nocturnal dipping process mentioned earlier. For most people, this drop is healthy and protective, but for seniors taking certain antihypertensive medications at bedtime, the combination of drug-induced blood pressure lowering and the natural nighttime drop can cause blood pressure to fall to low during sleep, a condition called nocturnal hypotension. Excessively low blood pressure during sleep reduces blood flow to the brain and heart, which can trigger ischemic events, meaning tissue damage caused by insufficient blood supply. Several studies have linked nocturnal hypotension in older adults to increased risk of stroke and cognitive decline. Conversely, and somewhat counterintuitively, there is also research suggesting that taking certain blood pressure medications at bedtime rather than in the morning may actually reduce cardiovascular event risk for some patients by ensuring the medication is most active during the early morning hours, when blood pressure naturally spikes upon waking and when heart attacks are statistically most common. The key point is that the optimal timing depends on the specific medication, the patient's blood pressure profile, and their individual health situation. This is a conversation to have with your doctor, not a decision to make unilaterally. The second category of concern involves sleep aids and sedatives, including both prescription medications such as benzodiazepines and the Z-drugs like zolpidem, as well as over-the-counter antihistamine-based sleep aids. These medications are widely used among seniors for insomnia, a condition that is genuinely common in older adults. However, sedative medications suppress respiratory drive and muscle tone during sleep, which can worsen or unmask sleep apnea, a condition that is itself a significant cardiovascular risk factor, as discussed in the next section. The third category involves diuretics, water pills commonly prescribed for heart failure, hypertension, and fluid retention. Taking a diuretic in the evening or at bedtime leads to frequent nighttime urination, which disrupts sleep and forces the cardiovascular system to repeatedly adjust as the person wakes, stands, and moves throughout the night. Each of these transitions involves a blood pressure change and a cardiovascular adjustment that cumulatively adds stress to the heart over the course of the night. The practical guidance here is to review the timing of all your medications with your prescribing physician or pharmacist. Bring a complete list of every medication you take, including over-the-counter drugs and supplements, and ask specifically whether the timing of each one is optimized for your cardiovascular safety during sleep. Do not change medication timing on your own without medical guidance. Some medications must be taken at specific times for clinical reasons unrelated to sleep. Habit number 3, eating a heavy meal or specific foods late at night. The relationship between late-night eating and cardiovascular risk during sleep is more direct and more significant than most seniors realize, and it goes well beyond the commonly known issue of indigestion or acid reflux, though those are real concerns as well. When you eat a large meal, your digestive system requires substantially increased blood flow to absorb and process nutrients. Your heart must work harder to deliver that blood flow. Your blood pressure tends to rise. Your blood sugar rises as carbohydrates are absorbed, and if the meal is high in sodium, the effect on blood pressure and fluid retention is amplified further. For a person who eats a heavy meal and then immediately lies down to sleep, all of these physiological effects are occurring simultaneously with the body's attempt to enter a restorative sleep state, and the two processes work against each other. The cardiovascular system is being asked to work hard to support digestion at the same time it is supposed to be entering a lower workload, lower pressure sleep mode. Research published in the European Heart Journal found that eating within 2 hours of bedtime was associated with significantly elevated nighttime blood pressure compared to eating earlier in the evening. For seniors with existing hypertension or cardiovascular disease, this elevation in nighttime blood pressure is a meaningful additional risk factor. Specific foods warrant particular attention. High-sodium foods, processed meats, canned soups, fast food, salty snacks consumed in the evening contribute to fluid retention and elevated blood pressure that persists through the night. Alcohol, which many seniors consume in the evening as a relaxant, has a complex and largely negative effect on sleep cardiovascular health. While alcohol's initial sedative effect may help a person fall asleep faster, it disrupts sleep architecture in the second half of the night, suppresses REM sleep, worsens sleep apnea, and causes blood pressure to rise as it is metabolized, often during the early morning hours when cardiovascular risk is already elevated. Caffeine consumed in the afternoon or evening through coffee, tea, certain sodas, and even chocolate has a half-life of approximately 5 to 7 hours in most adults and longer in older adults whose liver metabolism is slower. A cup of coffee at 3 in the afternoon can still have significant stimulant effects at 10 at night, elevating heart rate and disrupting the natural transition into sleep. The practical guidance is to finish your last substantial meal at least 2 to 3 hours before your planned bedtime. If you need a small evening snack, choose foods that are low in sodium, low in sugar, and easily digestible. A small amount of protein, a banana, or a small serving of whole grain crackers are all reasonable options. Limit alcohol to no more than 1 drink, consumed at least 3 hours before bed, and be aware of your caffeine consumption timing throughout the day. Habit number 4, sleeping in a position that worsens sleep apnea. Sleep apnea is one of the most prevalent and most underdiagnosed medical conditions among older Americans, and it is one of the most significant cardiovascular risk factors associated with sleep. Sleep apnea is a condition in which breathing repeatedly stops and starts during sleep. The most common form, obstructive sleep apnea, occurs when the muscles at the back of the throat relax during sleep, causing the airway to partially or completely collapse. When the airway collapses, breathing stops, oxygen levels in the blood fall. After several seconds to a minute or more, the brain registers the oxygen drop and triggers a partial awakening just enough to restore muscle tone and reopen the airway. The person often does not remember these awakenings, but they may occur dozens or even hundreds of times per night. The cardiovascular consequences of untreated sleep apnea are severe and well documented. Each episode of apnea triggers a spike in blood pressure and heart rate as the body responds to the oxygen deprivation. Over the course of a night with frequent apnea events, the cardiovascular system experiences repeated stress responses that would never occur during healthy sleep. Over months and years, this pattern contributes to chronic hypertension, enlargement of the heart, cardiac arrhythmias including atrial fibrillation, and significantly increased risk of heart attack and stroke. The American Heart Association formally recognizes obstructive sleep apnea as a major cardiovascular risk factor. Studies have found that people with severe untreated sleep apnea have substantially higher rates of cardiovascular mortality than matched individuals without the condition. Sleeping position is a significant modifier of sleep apnea severity. Sleeping on your back, the supine position, is associated with significantly worse sleep apnea than sleeping on your side. In the supine position, gravity causes the tongue and soft palate to fall backward into the airway, making obstruction more likely and more severe. Many people who have only mild or moderate sleep apnea when sleeping on their side develop severe apnea when they roll onto their back. Here is what you need to be aware of regarding this habit. Many seniors sleep on their back for reasons of comfort, habit, or because side sleeping causes discomfort due to arthritis, shoulder pain, or hip pain. Addressing those comfort barriers through pillow positioning, mattress adjustments, or discussion with a physician about pain management can make side sleeping more accessible and may meaningfully reduce apnea severity. If you or your bed partner have noticed loud snoring, gasping, or choking sounds during sleep, excessive daytime sleepiness, morning headaches, or difficulty concentrating, these are classic warning signs of sleep apnea and warrant evaluation by a physician. A sleep study, which can now often be completed at home using a portable monitoring device, can diagnose sleep apnea definitively. Treatment options including SPAP therapy, positional therapy devices, and oral appliances are effective and can dramatically reduce cardiovascular risk. Do not dismiss snoring as simply an annoyance. In many cases, it is a symptom of a serious and treatable condition that is placing nightly stress on your heart. Habit number 5. Your morning and evening routine habits that are silently raising your stroke risk. This final habit category is the one that surprises people most because it involves activities that happen right at the boundaries of sleep, in the first and last minutes of the day, that most people never connect to cardiovascular risk at all. The transition from sleep to waking is one of the most cardiovascularly vulnerable moments of the day. In the early morning hours, roughly between 6 and 8 a.m., blood pressure rises sharply as the body prepares for activity. Cortisol surges, platelets become more aggregable, meaning blood is more prone to clotting, heart rate increases. This pattern, known as the morning surge, is the reason that heart attacks and strokes are statistically most common in the early morning hours. For seniors, certain morning routine habits can amplify this already vulnerable transition in dangerous ways. The first is jumping out of bed quickly upon waking. After hours of lying still, the cardiovascular system needs a brief transition period to adjust to the upright position. Standing up suddenly causes blood to pool in the lower extremities, temporarily reducing blood pressure and blood flow to the brain, a phenomenon called orthostatic Hypotension, in older adults whose blood pressure regulation is less responsive than in younger people. This can cause dizziness, lightheadedness, and in some cases fainting with the associated risk of falling. More seriously, the cardiovascular adjustment required by sudden position changes in the early morning, when blood pressure is already surging, places acute stress on blood vessels that may already be narrowed by atherosclerosis. The safe practice is simple. When you wake, lie still for a moment, then sit up slowly and remain seated on the edge of the bed for 30 to 60 seconds before standing. This brief transition gives your cardiovascular system the time it needs to adjust and dramatically reduces orthostatic hypotension risk. The second morning habit of concern involves the immediate vigorous physical exertion that some seniors engage in right after waking, such as immediately beginning strenuous exercise, shoveling snow, or performing heavy physical work before the body has had time to fully transition out of the sleep state. Vigorous physical exertion during the morning surge period, before the body has warmed up and before the cardiovascular system has adjusted to wakefulness, is associated with elevated risk of cardiac events. A brief warm-up period and avoiding the most strenuous activities in the first 30 to 60 minutes after waking are simple protective measures. On the evening side, the habits that most elevate risk involve emotional stress and screen-based stimulation immediately before bed, checking emotionally activating content, distressing news, stressful emails, contentious social media in the hour before sleep activates the sympathetic nervous system and elevates cortisol and adrenaline. At exactly the time these stress hormones should be declining in preparation for sleep. For seniors with cardiovascular disease, hypertension, or a history of arrhythmia, this pre-sleep stress activation can contribute to nighttime blood pressure elevation and disrupted sleep architecture. The practical guidance for your evening routine is to create a genuine wind-down period of at least 30 to 60 minutes before your planned sleep time. During this period, avoid news and social media, dim the lights in your home, engage in calming activities such as reading physical books, gentle stretching, prayer or meditation, or quiet conversation, and avoid emotionally activating topics or decisions. This is not merely relaxation advice, it is cardiovascular protection. When to speak with your doctor. Everything covered in this video involves lifestyle habits that you can begin modifying on your own, but several of the issues discussed, particularly sleep apnea, medication timing, blood pressure patterns during sleep, and cardiovascular symptoms, also warrant direct conversation with your physician. Speak with your doctor if you experience any of the following: loud snoring or gasping during sleep reported by a partner or family member, waking with headaches or feeling unrefreshed despite adequate sleep time, frequent nighttime urination that is disrupting your sleep, dizziness or lightheadedness when standing in the morning, chest discomfort or palpitations at any time, or excessive daytime fatigue that is affecting your daily functioning. These symptoms are not simply signs of aging to be accepted and ignored. Many of them are treatable, and treating the underlying conditions they signal can meaningfully reduce your cardiovascular risk and improve your quality of life. Your primary care physician can refer you to a sleep specialist, a cardiologist, or other appropriate specialist based on your specific symptoms and medical history. 5 nighttime habits seniors should stop. Habit number 1: sleeping with the television on. The light and audio disruption suppresses melatonin, prevents deep restorative sleep, elevates nighttime heart rate, and activates the sympathetic nervous system. Use a sleep timer and consider a white noise machine instead. Habit number 2: taking certain medications at the wrong time of night. Blood pressure medications, sedatives, and diuretics all have timing-dependent effects that can either increase or reduce cardiovascular risk during sleep. Review medication timing with your doctor or pharmacist. Habit number 3: eating a heavy meal or consuming alcohol, high-sodium foods, or caffeine too close to bedtime. These elevate nighttime blood pressure, disrupt sleep architecture, and place unnecessary stress on the cardiovascular system during sleep. Finish your last substantial meal 2 to 3 hours before bed. Habit number 4: sleeping on your back if you have or are at risk for sleep apnea. Supine sleeping worsens airway obstruction, amplifying the cardiovascular stress of apnea events. Side sleeping reduces severity. If you suspect sleep apnea, seek evaluation and treatment. Habit number 5: rushing out of bed in the morning and engaging in pre-sleep emotional stress through screens and news. The morning cardiovascular surge is a vulnerable period. Transition slowly from sleep to standing, and protect your final hour before sleep as a genuine wind-down period. None of these changes are difficult. All of them are evidence-based, and any one of them implemented consistently can meaningfully reduce the stress your cardiovascular system faces during the hours you spend asleep. For medical guidance specific to your situation, speak with your primary care physician. For information on sleep apnea evaluation, ask for a referral to a sleep medicine specialist or visit the American Academy of Sleep Medicine at sleepeducation.org. For cardiovascular health resources, visit heart.org. If this information was valuable to you, please share it with a senior you care about. These are habits that affect millions of older Americans every single night, and most people never connect them to cardiovascular risk until something serious happens. A like on this video helps other seniors find this information, and subscribing to this channel means you will always have access to honest, calm, and trustworthy health and benefits information designed specifically for the senior community.